And then we'll do two teams, one maybe go to the Salvation Army.
We recognized that there was a need in Tampa, just based on statistics. Tampa had a really high rate of per capita homelessness, one of the highest in the nation when we came here. So that stood out to all of us as something that maybe was an issue that was unique to where we found ourselves and something that we could do something about.
My favorite part of medical school is also street medicine. I think that a lot of people assume that the homeless are lazy or that they don't want to work, but that's not the case with many of the people that I've met out here. Something just happens to them, either like a death in the family or an illness a lot of times, an injury, car accident, something like that. And it leads to a chain of events that they end up here in this position, and there's not a lot of resources or support for them.
Eric Monaco and Shauna Foley, along with 3 other students from USF Health's Morsani College of Medicine, founded Tampa Bay Street Medicine. They began the bi-weekly street runs in 2014 with just one backpack.
We had some basic meds, but we were in a completely different environment than the hospital or the clinics. As soon as the backpack opened, it was like the barriers were gone. As our supplies were moving out and the stories were coming in, we were just flowing through these new interactions and learning and being guided by the folks we were talking to.
The team uses patient feedback to adjust their services.
We started bringing more socks because we would always run out. We started bringing certain medications for certain people that we would see every week who'd be asking for them. Female hygiene supplies, we didn't initially bring those, which was an oversight.
I'll call a fib or something else.
Volunteer faculty physicians oversee the students. Dr. Waldo Guerrero is one of the regulars.
Tonight we saw a spectrum of diseases. We saw someone who had a heart infection to someone who has been passing out on a regular basis and actually has an implantable loop recorder in their skin, which is sort of one of the neurocardiology devices.
Students also benefit from the street runs.
Being able to deal with not having all the resources that you have at your hands in a large hospital and a large clinic, and having to make do with what we have out here in the streets. I think that's something that's a learned skill, and it's something that's very valuable. And just being able to sort of sit down and talk to someone and just hear them out, I think that's something we don't necessarily do on an everyday basis when we're just trying to churn and see multiple patients throughout the day.
The team's efforts have expanded beyond their nighttime rounds. They now host 2 monthly clinics in nearby community centers where they see their patients for private follow-up exams. The Well is one of the centers run by John Dengler.
We want to care for people holistically, body, mind, soul, socially. And one of the physical needs we aren't able to meet is just give basic medical attention. And so my argument that it was a good fit was, you guys go out on the street, which is fantastic, but then you leave. But if you do it here, when you leave, we got them. We can care for them the rest of the month. Now, we might not be able to do the things you could do, but we stay in relationship. We have a place for them to be and family. And so it supplements the thing they can't do, and it provides for us a thing that we can't do. And so it's a bridge that we wanted to build,
We had a super successful day. We saw 15 patients.
The biggest priority is getting to a point where we're known in the community so that they know that there's a group of people on whom they can rely for health services and to try to get them in and improve their health.
So you said that you're trying to get the okay from the heart doctor.
I've got diabetes, high blood pressure, I've had a number of heart attacks. So I'm trying to do what I can as far as watching my diet, and they're enabling me, even without medication, to watch my weight, keep a check on my blood pressure, things that I wouldn't be able to do on my own.
Tom is a man who's 60-something years old, and we know if he's ill at any point, he's getting to the age where that's going to happen. And Tampa Bay Street Medicine is going to be one of the first people we go to when those things happen, because they're the people that we know and that are willing to see our guests and help our folks, and now have been building relationships with many of them. And that helps a lot.
For USF Health News, I'm Sandra Roa.